design rolling?
About the gym, why the gym?
For me, it's kind of the thought of bringing the gym to the ICU. A lot of the patients that are in the intensive care unit, they've been in bed for potentially several days, and it's difficult for them to stand, to be able to start to walk. So a lot of the things that we can do in the gym can help to bridge the gap, to help them participate in some different forms of rehab and therapy to help facilitate them being able to get back on their feet. In the old ICU, when we didn't have the capability of having the gym, we were pretty much confined many times to what we could do in the room, what equipment we could bring in the room. But now we have a site where we have some equipment where if the patient is stable to do so, we can bring them out into the gym. And also psychologically, I think it's good for the patients to get them out of their room in a different environment.
Talk about that just that part of it.
Yeah, well, in the intensive care unit, there's a lot of things that one goes through, obviously medically, physically, but I think emotionally and psychologically. Right now we're standing and talking and be able to hold a conversation. I mean, a lot of these individuals, after what they've been through in the ICU, just them carrying on a conversation, them standing up is something that they are longing for and that we take for granted. So, that's why that we have this setting here, is to help again facilitate their return to those things that we all take for granted.
That's an interesting point. That so much of, especially in an ICU, is about just getting medically better, but if you're mentally better, that contributes.
Definitely, a lot of the things that we have to battle with, if you will, to help patients overcome in this setting is an emotional and a psychological component. So I think having things like a gym, the way that we design the rooms for family to be an integral part of the patient's recovery, the lighting in the hallway, I think the artwork and the colors, it's all designed to help lift someone's spirits and to kind of get that mental focus on getting better and getting home.
That's great. About the gym in particular, what do you most typically do with someone? It's just you have some of your equipment that you're able to use?
Yeah, so obviously this is not anything akin to a Columbia Basin Racket Club or a Gold's Gym or anything like that, but the equipment that I was able to put in here was really designed to help, again, just increase movement and strength, with the goal being to get them to the point where they can start to stand and walk and move. We have retractable parallel bars that we can use for patients to add that stability. We have a large mirror that again can give that feedback of visually how they're moving, how their balance is. Behind me here we have some different TheraBand, some things that we can use for someone who maybe is in a wheelchair to work on building their arm strength, and then we have a pretty fancy kind of total body leg bike machine that we can use as well.
So for this particular unit on a construction design, I think you really capsulized it well of all the features, but as someone who works in this unit, what does it mean to have been part of the design process and now actually seeing what you designed and are putting into action?
Yeah, it's a surreal experience to be a part of that, to have your input and then to see that take shape in the form of the gym and some of the other things that we all had a part in, with just the room design, the design of the hallway, the nurse servers, and those kind of things. It's one thing to design it and to plan it, to see it in a drawing, but then to see it come to form and to actually see a patient and to be able to treat patients within that environment, it's pretty amazing. And obviously there's a few things that you think, oh, well, maybe we could have done this a little bit better, but I really think for the most part we were pretty successful in implementing what we wanted to do when we set forth with this.
Is there anything we haven't covered that I guess you think is really germane to what we're trying to do?
No.
I've got, I think, 2 really good sound bites on it.
Yeah, no, I don't think so.
Good.
The next question